And Stacie, take it away.
Hi, everybody. My name is Stacie Brown. I am the outreach coordinator for the Overdose Prevention Program at the Allegheny County Health Department. So I'm going to share my screen. We're going to go through our presentation on overdose prevention and just being active in our communities as far as what happens during an overdose, what are the individuals going through. Some of the slides, I'm probably going to scoot right through them. Some of them are important. Not that they're not important, but some of them don't always pertain to the conversation we're having. So, as we all know, this isn't the first rodeo with drug issues within our society. Unfortunately, back in the early 70s, we had a war on drugs declared for a whole different meaning. It definitely was not to help individuals. It was more to create barriers for certain residents. If you were Black, you were connected to heroin and you were incarcerated. If you were against the war, you were connected to marijuana, again, incarcerated. And it continued through each one of our administrations. It all became a just say no, complete abstinence. Drugs are bad. It also increased incarceration. So under Obama, right prior to Obama, we had a sentencing disparity that certain substances fit certain communities and they got a higher incarceration sentence than a substance that may have fit a upper class community. Right after Obama took office, he signed our Fair Sentencing Act, so it did away with it. It also was the very beginning of the opioid overdose epidemic. And it just has been complete up and down since 2015. Another thing that came out of that administration and the one after was the Good Samaritan Clause. So that gives immunity to individuals like us, no medical degrees, the legal right to carry and administer Narcan, and immunities, criminal, civil, and professional, if something was to happen during that, as long as we act in good faith. So good faith meaning you call 911, you administer Narcan, and you stay with the person that is overdosing. So, sorry, in 2016 is where we started to see a huge increase. 2017, we were at the highest ever. These are total fatal overdoses just in Allegheny County. In 2017, we lost a lot of young white males to IV drug use. So there was a lot of heroin out there, a lot of IV use. 2018, we had a 40% decrease. And ever since then, we've started to climb. The pandemic definitely did nothing good for the epidemic we were already in. In 2021, we lost 721 individuals. And right now, currently, we're at in 2022, as of April, I think it was, we were up over 250 individuals. So unfortunately, it just seems to be increasing. We also have seen a difference in the individuals overdosing. So like I said previously, we've seen a high increase in our young white males with IV drug use. Now that the drug supply has changed, lack of resources in certain communities, we're losing our Black residents at a 2-time higher rate due to fatal overdoses. So what we did in Allegheny County, and this dashboard is public, and it is a great piece of information. We have a team of overdose surveillance. They're from our epidemiology department. They developed a dashboard. And in this dashboard, you can find by communities, zip codes. You can break down deaths or fatal overdoses and non-fatal. So you can break down fatal overdoses by year, substance, age, race, gender. Um, you can also go into non-fatal, and you can look through EMS reversals, emergency room reversals. And if you're somebody like me that does a lot of outreach and a lot of community engagement, especially in overdose prevention, this is the tool I use on a daily basis. And hopefully that link works. We got some feedback that said sometimes it did or didn't. If it doesn't, those names at the top, Allegheny County Overdose Dashboard, that's all you have to place in your Google search bar, and it'll take you right there. So when we talk about overdoses, we're primarily talking about opioids, opiates. One is natural, one is synthetic. So the natural is made straight from the plant. That's our opium, our morphine. The more synthetic and semi-synthetic are made from labs. So that's our heroin, our fentanyl, the methadone. All of those are found in substances in Allegheny County. But primarily we're seeing a lot of fentanyl. And because fentanyl is 50 times stronger than street level heroin, certain types of the illicit fentanyl takes 3 grains of salt amount to kill an average sized male. Until recently, there was no way for individuals to know what was in their substance. Like if I go to Giant Eagle and I buy a bottle of Tylenol, on the back are ingredients. Every single pill in that bottle has an equal amount of every ingredient. So if I break it in half, I'm getting half of those ingredients. Unfortunately, in substances that are purchased off the street, we don't have no way to find that out. There are fentanyl test strips, but they're still considered paraphernalia. There's a bill at state level that we're hoping will pass. If not, it has to like be rewrote, and unfortunately, it could take a longer process. But what we are seeing are pressed pills. It's highly suggested that if you know anybody that is using substances that was not handed to them by a pharmacist, to please carry Narcan. These pills are counterfeit. They're ordering these pill presses offline. They're pressing these pills. Sometimes they'll contain all kind of different things in there. But if it contains fentanyl, there's a high chance the individual could overdose. And when you look at them, you can't really tell the difference. There may be a minimal amount. So I do want to bust some myths. So we hear a lot of chatter on social media that, people are coming into contact with fentanyl and they're experiencing symptoms of an overdose. And I've been having this conversation a lot. There is a pit doctor that does a video that he shows himself holding illicit fentanyl in his hand. Fentanyl is the same as any other substance. It has to be absorbed into your system, whether that's through your mouth, nasal, you can touch it and touch your eye. You can inhale it. You need a lot to inhale. But you cannot just come into a room and somebody have fentanyl on a table and you experience an overdose from it. To me personally, what that does is that deters somebody from responding to an overdose because of that fear. And we've lost too many people in Allegheny County. Narcan does work on fentanyl. I know there was another rumor going around that there was Narcan resistant fentanyl. Sometimes fentanyl is very fast acting, so you almost have to be right there with them. And then we talked about it's not made in a lab. So people use. Why do people use? That's like the number one question when you talk about, can I train you on Narcan? And somebody will say, well, why do they use? There's so many different reasons. I'm transparent in who I am. I'm in long-term recovery. I probably hit maybe all but three of these bullet points. Underlining trauma, peer pressure, pain management. We have a lot of individuals that will use for pain management. And higher risks could just be mixing substances. We see a lot of, we're in a pandemic and we tell everybody, listen, stay away from everyone, quarantine, isolate, things were shut down. But those that work in overdose prevention, we always tell people don't use alone. Always have somebody there with you that can administer Narcan. So we've seen a lot with using alone in COVID. Recent release from incarceration, our individuals are 129 times more likely to overdose within the first year of being released from incarceration. So what happens during an overdose? So we have receptors that control our respiratory system. An opioid overdose is a respiratory system shutdown, let's say. There's no other symptoms. The rapid heartbeat, the sweaty palms, the anxiety. Unfortunately, they're not signs of an overdose. They do resemble signs of a panic attack, but I know for a fact that an overdose suppresses your respiratory system. So we have these receptors. The opioid goes right to it as it shows in the green head. The orange head is what happens when you indulge in an opioid. It just overloads it. Narcan is like the big brother. It goes to those same receptors and it just knocks off the opioid. Two things. It then will take a seat right on those receptors. So it sort of blocks the opioid from coming back to those receptors, but it doesn't remove it completely from the person. And Narcan does wear off in an hour. Okay, so we're walking down the street and this has happened, and this is a true story. You're on your way down Smithfield Street to pick up your lunch, and you see a group of people like in a doorway, and there's somebody laying on the ground that's not breathing. The first thing you want to do is look for physical signs to see if it is an overdose. So some of those signs are the color of their skin. If they're white, they're going to look a blue color. If they're black or dark skin, they're going to look a gray color. Their skin may be clammy. Their breathing, they may be shallow. It may be like a gurgle sound. They could be not breathing at all. So what you want to do is you want to lay them on their back and you want to do a sternum rub. It's when you take your middle finger and you rub right at the top part of your chest. It's to give some stimulation. You want to see if you have a response or not. You do your sternum rub firmly. If you have no response, administer your Narcan. And I'll explain exactly how to do that. After you administer your Narcan, you want to call 911. Some people say call 911 first and then administer Narcan. In that situation, I was on the phone with 911 they asked me like probably 25 questions, and that person was laying there not breathing without oxygen. So I just set the phone down and gave Narcan and then got back on and started answering more questions. They have a job to do too, but I wanted to give this person a chance to start to breathe again. So when you administer Narcan, it's peel, place, press. You're going to peel the package open. You're going to place the canister in between your pointer finger and your middle finger, just like the picture. You're going to place the plunger into the nose, or the tip of the nozzle into the nose, right till your fingers touch their nose. And then you're going to press firmly on the plunger. It's one spray, one side of the nose. While you're waiting for first responders, you can do CPR. Rescue breathing is very important because the person's not getting oxygen. But again, we're in a pandemic, and I don't want to see you start to do rescue breathing without some sort of protection. So if that's the route you're going to use, put a barrier. We give out CPR face masks. You can use your t-shirt, your face mask, something that puts a barrier to protect you and them. You can do chest compressions. Or if you're not comfortable doing either, 911 will stay on the phone with you and talk to you through all of it. They kept having me do the sternum rub just to see if I could get in some sort of response. In about 3 minutes, if you don't see any movement, if they don't start breathing, if the color doesn't start coming back, you can administer the second dose. So it's look for signs, lay them on their back, do your sternum rub, administer your Narcan, call 911. If you don't get a response out of that person, you can administer your second dose in 3 to 5 minutes. Some little caveats. If you don't wait the 3 to 5 minutes and you do it sooner, it's okay. There's no room for abuse on Narcan. It can't hurt somebody if it's not an overdose. You can't overdose somebody on Narcan. It only works on opioids. However, a lot of our substances we're seeing in Allegheny County have fentanyl in them. Crack cocaine, meth, K2, pressed pills. So people are getting what they think are Xanax, which is not an opioid, and it contains fentanyl. And Narcan can be used on children and pets. Accidents happen. If a child gets into your medication and they're unresponsive, you can administer the same dose of Narcan on the child. When we talk about overdose prevention, we're talking about harm reduction. And I know these are two like swear words to some people. I've been in several debates on social media about harm reduction. Harm reduction is a public health approach to lessen negative consequences associated with drug use and risky behaviors. My seatbelt. When I am famously running late for a meeting, I put my seatbelt on. My risky behavior is speeding, but my seatbelt is there in place to reduce my negative consequence. Condoms, motorcycle helmets, designated driver. It's all forms of harm reduction. And what we're taking is the harm reduction approach. We're meeting people where they're at. We're not expecting people to come to us. We work on reducing stigma. We connect individuals to education and naloxone. Community engagement is a big, big part of the approach. And so that's how you can support it. You can distribute Narcan. You can make sure your businesses, your employers, your schools, your neighbors all have Narcan. Again, Narcan doesn't enable somebody to use. But what does block a lot of this, the reaching out for help, that the saying they have a problem is stigma. So it's a huge barrier to receive all kinds of treatment, but the effects are harmful to the individual. they start to feel very negative about themselves. Because what we tend to do in its human nature is we tend to put labels on people. Individuals are not their disease. So I'm not Stacie the addict. My neighbor's not a junkie. That's a person who uses substances or a person with substance use disorder. But unfortunately, with substance use, there is so much stigma that we try to separate it from the actual disease that it is. Prime example is the word relapse. So relapse is a 12-step term, and we use it outside of 12-step a lot, but it associates with a failure. Because if we're talking a medical condition, like addiction, like mental health, like cancer, we don't say relapse. We don't say my cancer relapsed. It reoccurred, or my symptoms have reoccurred. But we label individuals that make decisions that are different than ours. The ultimate goal through all of this is some form of recovery. So recovery is a change that the individual makes. They work on their health, they work on their community relationships, their mental health part. But abstinence is not everybody's goal because we have many, many, many different pathways. My goal may be abstinence based right now, but it always wasn't. It's just more socially accepted to say you're abstinence based. But we have medication for opioid use, so Suboxone, Vivitrol, methadone. There's faith-based, there's holistic, spiritual. We have online recovery, but ultimately people can't recover if they're not here. And again, I cannot tell you 100% that Narcan is guaranteed. So, but what I can guarantee you is that somebody's child laying there. They may be an adult. And unfortunately, we have our youth that are starting to experiment more with some other substances. And so we've been really trying to educate. My daughter's 14. She's known how to use Narcan since she's been 7. A big part was me because I am in recovery. But now I see her friends and I see her classmates. And I don't ever want her to be unprepared to be able to help someone. So where can you get it from? Us. We can provide it to anybody. We purchased it under a grant. We also receive an allotment from the state. Prevention Point provides it at all their locations. If you live in a rural community and you don't have a lot of access to resources, Next Distro will mail it to you. And then in Pennsylvania, you can walk into any pharmacy. However, if you have insurance, it will go on. And if you have a copay, you have to pay the copay. If you do not have insurance and you go into a pharmacy, it's a little costly. Another one of my debates, Narcan is definitely not free. We give it out to the community, but we purchase it at a public health price. And at a pharmacy, I think it's around $120 to $140. So I always like to share some resources. These are resources, really good ones for the individual using substances. Pathway to Care and Recovery is a phenomenal program. It is like Resolve, but for drug and alcohol. Same setup. They're open 365. They have mobile assessments. They can take somebody to treatment. They can engage in them to get them into treatment. And now if you're looking to get into treatment and maybe the bed's not available for a few days, you can stay in their engagement center upstairs. Using substances affects our families as well. So we provide some family resources. And then we also share some adolescent resources. We just had a fatal overdose with a 13-year-old Pittsburgh public school student at the end of school last year. And so we're starting, I don't know why Gateway has www before the phone number, but sorry about that. We're starting to try to work a lot with our youth. So I know I gave you guys a whole bunch of information, but what I am going to do is I'm going to stop sharing my screen and then we can open for comments, conversation. And I will also put this into a PDF version and share it with Tori, and she can share it with anybody that's been on this training. Because I do give a lot of information in like such a short period of time. And I know sometimes it is a whole bunch to take in. We did not talk about this in here. Narcan does expire, and you can also keep it in your vehicle in the summer, but in the winter, there is a little bit of liquid, so it can freeze. The only way to know if it's frozen is when you go to use it. So if you can remember, try not to keep it in your car during the winter months. Does anybody have any questions? Or I seen some things floating in the chat, but it's very hard for me to multitask and like read the chat and try to. I seen somebody said they wanted Narcan.
Yeah, that's what I was just going to say, Stacie. Can you tell? I'm sure people may want to reach out to you. How should they get Narcan from you?
So we can definitely, I can put my email in the chat. I can also put the link that we have where you can request Narcan. If it's easier just to email me, you can just shoot me an email. And we, depending on where you're at in the county, we can have it delivered if it's too hard for somebody to get downtown, because we're located in downtown Pittsburgh. But I am always out in the community. A lot of our other programs are out in the community. So if it's easier to do it that way, we can do it that, or you can stop by the office and pick it up. But I'm gonna put maybe, there we go, my email address in the.
Stacie, I see you often on events, and I can get it from there too, right?
Absolutely.
Okay,
Absolutely.
perfect. Thank you.
Yeah. Yeah, we are out in the community a lot. We utilize the dashboard very much. And so we get a few providers together and we just go out and do some outreach.
I guess that's the other thing is I know that you have like a schedule of pop-ups, like where in different communities, if somebody either wanted to work with you on that, or do you have a schedule for where you're going to be this fall? I know you're like all over the place.
So I put the link up also that you can get on and request Narcan as well. So yeah, so we are planning our October and November pop-ups. We have about 12 communities. We're going to do 6 in October and 6 in November. I wanted to do a little bit more, but September really has wore me down from recovery month. And if I get another event within like the next 2 weeks, I may cry in my office by myself. Um, so, but yeah, I know we're looking to go to like Hazelwood. We're going to be in the Mon Valley a few times. We are going to be in Bellevue. We have a lot. I can send you, Tori, some of the communities that we're going to be in. Unfortunately, we just don't have the dates right now until we can get in contact with the partners to see if we can set up there. I wish it was just easier to drive and just set up on a corner somewhere and not have to like get all the permissions that we do, but
And to answer Sharon's question, we will be sending the presentation in the form of a PDF, correct, Stacie? Yeah, so I will email that to
And
everyone who
Danielle,
attended.
I see you said you're a community health worker in Hazelwood. If you would like to collaborate a little bit to maybe do a Hazelwood event,
Yeah,
because if it's a community that I'm not too familiar with, we tend to take a drive through it.
right.
I need to be like where people are at.
Yeah, we can definitely like link up and maybe I could like show you around or whatever you think is best. But yeah, definitely that would be great. I don't think we've had anything like that come to Hazelwood, not that I know of. So it's definitely needed.
Yeah,
Yeah,
I
we
would
definitely
love
have.
to.
I'm the other CHW from Hazelwood. I was gonna put my email in there for you.
Okay.
Thanks.
Oh, yes. Thank you, Sean. Because I've tried to navigate the city, Pittsburgh parks. And then we just did one at Esser Plaza, the little parklet in Southside. It was just a small little parklet, but I want to try to do something like maybe in one of our other city parks. I live in the city, so like I'm pretty familiar with a lot of them. So I definitely will reach out to you and talk about it.
That's great. I mean, I think like Mellon Square downtown, you're talking Smithfield Street, so right, that area, over across from like Giant Eagle over in Allegheny Commons. I think there's some definite touch points that we could do
Oh.
some really strategic outreach.
We just did one Friday right at the Elks, right across the street from the Commons, only because I didn't know how to figure out to get into the Commons, and my dad used to run the Elks, so I went on that favor. But we had, which it was really big, we had about 18 providers with us. Like it went up the whole block, the rows of tables. We connected 3 people with treatment that day. We got one person connected with a homeless service provider. They got a tent and a sleeping bag. We tested, so we partner with Allies and we do community Hep C and HIV testing as well. They tested, I think, 6 people that day, which was one of the highest numbers that they've ever. Yeah, it was a pretty busy day on Cedar Avenue.
Well, thank you so much for all of your work. I mean, it's really incredible, and we need a heck of a lot more of it. I also think like Shenley Plaza in Oakland, right? So we talk about like these areas that we may see that there's a need, but there's like a lot of these college kids that could be using and they don't know what they're using and all these. So like an entire education outreach to them. So again, you've got my email. I'm happy to connect.
Absolutely. I appreciate it very much. And Tori, thank you for having me present. And Hannah, this is really good. Nobody really should have to die from an overdose, whether they make a decision to use that's different than ours. Unfortunately, that fear that our media has put into us about the fentanyl, some of our out of state first responders have put into us, stop individuals from responding to overdoses. And if you're safe and you protect yourself, then you'll definitely save somebody's child. 100%.
Stacie, Kelly Boland put a question in the chat about like suburban, Mon Valley communities. And one thing that she's asking, which I think you could speak to about like the hot spots in the county. Can you just talk a little bit based on the data that we have of where you're prioritizing?
Yes. So I can actually pull up on my phone and talk about the hotspots. So what we do in order to develop our quote hotspots is we look over the data from the last, say, 3 years, and we look to see if there's been an influx. So if there's been a huge increase, or if there is a steady amount. And then we will internally meet and discuss. So, for instance, I'll say downtown, we got 15219 is, of course, one of our highest zip codes. And so then I'll work with our community partners in that zip code to see exactly where in 15219, because that is a huge zip code. But suburban, as far as Mon Valley, we're looking at East Pittsburgh, McKeesport, Glassport, Duquesne, North Braddock, Clarendon. I know Hazelwood is not part of the Mon Valley, correct? But
Still in the city.
Yeah.
I mean, it's along the Monongahela
Right.
River. It is still in the city though.
Yeah.
Millville. So going the other way, we have like Millville, South, we have South Sides, Homewood, Garfield, Bloomfield, North Side, Grafton, Carnegie area, McKees Rocks, and Coriopolis. And they're primarily our top 20 that we're going to try to focus on for October and November. And if the weather is okay, I will be out there in December too, just up until it gets a little bit too cold that I can't feel my fingers. Then we won't be out there no more. But we were out there last December with a heater on
Oh, wow.
North Avenue.
That's amazing. That's dedication.
Yeah. Yeah. Elena from our STD program and I were out there. I had my husband bring us like the patio heater so we didn't freeze, but I know this is very close to my heart, this type of work. So I am very passionate about it. However, I know there is a solution in it. And if more people were aware of it, then we can maybe try to stop the stigma or break the stigma around, you know, once an addict, always an addict, or they're just going to keep using, or Narcan enables them to use. Unfortunately, none of that is true. Again, it's just the harm reduction approach of meeting people where they're at. I do know though, I can tell you by just looking at our data from between the last 2 years, from 2020 to 2022, we've had 45 non-fatals and 5 fatals in 15219. So just looking back at some of our, like McKeesport, I don't have the information for that one. Of course I'd pick that one. South Side, we've had 83 non-fatals, 6 fatals. And that's just on not counting South Side slopes. But we also have a dashboard internally that we do work with our STD program that will show us Hep C rates, syphilis rates, and overdose rates. So we can sort of get we did add in unvaccinated rates. And we were sort of doing a cross-program collaboration where we were out giving Narcan and condoms and immunizations all on the same corner, a little bit of Hep C testing, and
That's great, especially for addicts who aren't going to take out of their day to like go and do that. So to just have it right there, that's like great. that obviously makes a difference. You could see with the numbers. So
yeah, does anybody have any other questions? And if you do have a question and you don't want to ask it on here, please do not hesitate to email me. I promise you, I can definitely, if I don't have it, I will try to figure it out and get back to you. And I'll share the PDF tomorrow morning if that's okay, Tori, because I think we have an event today. I have an event today, so I'll be in McKees Rocks.
Yeah, that works.
Yeah. We are meeting though. I'm not sure if like the Hill District, we have a group on Dinwiddie that wants us to come up and do a larger health community outreach up there. So, but again, real quick, if you're in a community and you want to do something like that, please reach out to myself or even Victoria. We can definitely get together. A lot of our programs do collaborate together, and we come out our chronic disease, our traffic safety, our STD, overdose prevention, vector. Our vector control program has been coming out pretty good with me too. Although they're not helping me with them red lantern flies, but we got attacked by them at the last event. We had to close up early.
They're crazy. I was downtown yesterday. I didn't want people to think I was crazy at the bus stop trying to like kill them all.
That was us at the Onalla. They literally are infested with them because of the woods. And I was just an hour and a half early. I was like, my stress level was at its max.